Matthew Perry died from the acute effects of ketamine, according to his autopsy report, and a medical expert suspects that he may have obtained the drug illegally. One of the world's top neuroscientists and doctors, Dr. Bankole Johnson, exclusively tells Page 6 that it is more likely this was recreational ketamine use. It would be questionable medicine to provide ketamine to someone also using buprenorphine, a true recipe for disaster. The Friends alum was receiving ketamine infusion therapy for depression and anxiety, according to the LA County Medical Examiner's Office report. His last known treatment was a week and a half before he passed away. Ketamine is generally safe when administered by trained health professionals in a medical setting for the treatment of depression or post-traumatic stress disorder, according to Dr. Johnson, the CEO and founder of Casa Preve in Miami. He goes on to say that medical professionals prefer to administer ketamine by IV because the dose can be calculated accurately in this setting. But intranasal use is generally less safe because it is frequently self-administered, Dr. Johnson cautions. Additionally, this may encourage more aggressive drug use. He continues, wherever they may be, the best advice for those in need of ketamine treatment is to find an excellent physician and specialized facility like ours. Since ketamine has a half-life of 3 to 4 hours or less, the ketamine in his system at death could not be from that infusion therapy, according to Perry's report. Co-star Jennifer Aniston of his Friends recently stated to Variety he had given up smoking. He was getting fit. I just know that he was happy. Funny Maddie, I was actually texting him that morning. He didn't feel any pain. He wasn't having any trouble. He was content. Perry's toxicology results showed that 271 nanograms per milliliter of ketamine was found in his central blood source and 3,540 nanograms per milliliter in his peripheral blood source. For context, the report states that general levels in monitored surgical anesthesiologic care fall between 1,000 and 6,000 nanograms per milliliter. When Perry passed away, his body also contained buprenorphine, an opioid-like medication used to treat opioid addiction. According to Dr. Johnson, ketamine is a scheduled medication that can only be prescribed by licensed physicians or nurse practitioners. At-home microdosing is an option, but it can be dangerous and generally has low efficacy, he says. Perry's history of drug addiction and substance abuse was well established. In fact, he had disclosed his personal struggles in his memoir Friends, Lovers, and the Big Terrible Thing. The star of 17 again acknowledged in the 2022 book that a few years earlier, he had an opioid overdose that caused his colon to burst, and doctors had given him only a 2% chance to live. I was put on a thing called an ECMO machine, which does all the breathing for your heart and your lungs, he said at the time. That is referred to as a Hail Mary. Nobody makes it out of that. In his best-selling memoir, Perry also revealed that he had attempted to get sober for almost $9 million and had come dangerously close to death after swallowing a quart of vodka and 50 Vicodin pills.